Hello, welcome to Men Life Hacks. Today, I have a very interesting topic for you all. We'll be trying to understand why are females more likely to develop urinary tract infections more than males. So, urinary tract infections are common in females, but are a little bit rare in males. Every lady at one point in their life may have developed a urinary tract infection. The first reason is that the female anatomy predisposes them to having urinary tract infections. The urinary tract in both males and females, it ends in a tube called the urethra. It ends in a little tube called the urethra. Now, in females, this tube is very short. This tube connects the bladder where urine is temporarily stored before evacuation to the exterior of the body. In females, this tube is 1 to 1.5 inches long. That's about 3 to 4 centimeters. So it makes it easy for bacteria that find themselves at the urethra opening to easily ascend into the bladder where urine is temporarily stored to cause infection. In males, this tube is about 8 inches. That's about 20 centimeters. So it has a very long distance to travel. So it reduces the chances for males to develop urinary tract infections. Now, another reason that accounts for women always developing urinary tract infections more easily compared to males is that this very urethra, this tube which connects the bladder to the exterior of the body, is found very close to the anal region and the anal canal, the anus in general. And this region contains a lot of bacteria. In males, it's nearly in the opposite direction. It's nearly 180 degrees. So, bacteria easily find themselves traveling from the anus to the tip or to the opening of the urethra, which can easily now find themselves migrating into the bladder to cause infection. Now, ladies, this goes to you. When you are cleaning, these are ways by which we can help to reduce urinary tract infections in ladies. We can help to prevent them from the comfort of your home. When you are cleaning yourself after pooing, after having a bowel movement, after stooling, you should clean in the direction that is away from the urethral opening. That is from the vaginal direction to the outward direction. That is outwards. In this way, you make sure that bacteria don't leave from the anal region to find themselves deposited at the urethra opening. So you don't clean from outside, that is the anus, towards the vaginal area, because you are going to carry bacteria which are heavily infested around the anal area towards the urethra opening. Also, make sure that you practice good hygiene, especially for your underwears, as this could harbor bacteria that will lead to infection. Now, when you are also experiencing your flow as a woman, your period as a woman, make sure to change your pad as frequently as possible. The blood that is trapped during menstruation could be a very good harbor for bacteria, and they could find themselves at the urethra opening and climbing to cause you a urinary tract infection. Now, ladies, some of you might have experienced the following symptoms. You have pain on urination, you have pain in your abdomen, you have fever, a high fever, you pee more frequently, even if the urine just comes out in small bits. When you experience these symptoms, you might be suffering from a urinary tract infection. Please, when you do, consult your doctor or your healthcare provider. But if you are able to practice the guidelines I've given above, you should greatly reduce your need to see a doctor for a urinary tract infection. This does not mean that they are not common in males too, but then we're just trying to see why they are more common in females. Hope I was able to help you. Thanks for watching. Ciao.